Hello everybody, this is Dr. Rob Lindsay again with our autoimmune treatment success number 12, the adrenal glands. Now your adrenal glands make a hormone called cortisol, okay? They sit right on top of your kidneys and they're your stress glands. They make a lot of hormones for your body in addition to cortisol, such as aldosterone and androgens. Now your adrenal glands are vital for optimal health. When your adrenal glands are not working, it causes high levels of cortisol in your system. And this is why you still have some kind of a problem when your other lab tests may be normal. Cortisol is one of the main factors that regulates your blood sugar level, not insulin. Everybody thinks it's insulin, but it's actually cortisol. When cortisol is released by your adrenal glands, it's accompanied by cytokines. Cytokines suppress the ability of your pituitary gland and your hypothalamus to make thyroid-stimulating hormone, as an example. So your adrenal glands make cortisol in response to stress, whether it's physical, chemical, or emotional stress. And cortisol also promotes inflammation, which makes your adrenal glands pump out more cortisol. As cortisol is released, the cytokines come out along with it and suppress your pituitary gland. There are many common causes of elevated cortisol, some of them being chronic stress, post-traumatic stress disorder, or hidden gut infections such as parasites. You would be surprised at how many people have parasitic infections. Other causes of elevated cortisol include blood sugar dysregulation, high or low blood sugar, hypoglycemia, insulin resistance, and diabetes. You need to make sure that your blood sugar level is stable. Now, we've talked about this. And you need to understand that when you have these problems, when your blood sugar level is going up or down, so are your cortisol levels, which means your cytokines are going up and down, which means your pituitary isn't working properly, and you're not going to be able to make enough thyroid-stimulating hormone or other hormones. So you start having symptoms of a sluggish thyroid, as an example. You might have fatigue or hair loss, cold hands and feet, okay? Insomnia, inability to lose weight, depression. Don't forget, there are several types of blood sugar problems as well, not just diabetes, but also hypoglycemia, low blood sugar, and insulin resistance. Now, hypoglycemia, remember, is a blood sugar level of 85 or lower. Insulin resistance is a fasting blood sugar level of 100 to 126. Diabetes is fasting blood sugar level of 127 or higher. So be aware. If your stress levels are high, your adrenal glands are going to pump hard and cortisol levels are going to increase. Cytokine levels are going to increase and will cause your pituitary not to function properly, which is going to affect all kinds of things in your body. And high cortisol will sabotage your attempt to combat your thyroid problem or any other autoimmune disease. If you're suffering from adrenal fatigue, you need to avoid refined sugar, alcohol, and caffeine, because these are high stressors to your immune system. And don't think you can get away with eating aspartame or MSG, because these are the worst things you could do for your adrenal glands. Alright, now I hope this treatment success secret was helpful for you. If you put these things into practice, you're going to get better. But we still need to find out what's driving your autoimmune condition, and that's why you need to call us so you can come in and get checked. 952-949-0676. I look forward to seeing you on our next Success Secret. Thank you.